Hi, my name's Mia Evangelista. This is my medication commercial on haloperidol, brand name Haldol. Do you know anyone diagnosed with schizophrenia, or maybe you are diagnosed with schizophrenia? An individual with schizophrenia can present with delusions, hallucinations, disorganized speech, flattened affect, reduced speech, and/or lack of initiative. If you do know anyone diagnosed with schizophrenia, this may be the drug to help. Not only does this drug assist in treating schizophrenia, but it also reduces aggression and treats uncontrolled movements and outbursts of sound related to Tourette syndrome. Haloperidol does wonders to treat severe behavioral problems such as explosive, aggressive behavior or hyperactivity in children. How does this drug function, you may ask? Haloperidol blocks the dopamine receptor and activity in the brain. With all of the positive outcomes of haloperidol, of course the drug comes with side effects as well. Very little amount of side effects. A few to mention are dry mouth, increased saliva, blurred vision, loss of appetite, constipation, photosensitivity, diarrhea, heartburn, nausea, vomiting, difficulty falling asleep or staying asleep, blank facial expressions, uncontrolled eye movements, unusual, slowed, or uncontrollable movements of any part of the body, restlessness, agitation, nervousness, mood changes, dizziness, feeling unsteady, or having trouble to keep your balance, breast enlargements or pain, breast milk production, missed menstrual periods, decreased sexual ability in men, increased sexual desire, difficulty urinating. Reportable symptoms are associated with tardive dyskinesia, which is writhing movement of the tongue and neck, purposeless movements of limbs or trunks. If tardive dyskinesia occurs, stop taking haloperidol immediately as it may not be reversible. How should you take haloperidol? Haloperidol may come as a tablet or concentrated liquid to be taken by mouth. It is exciting to announce Haldol may come as an injection administered intramuscularly and as a nasal spray. Haldol injection is not approved for intravenous administration. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. It is worth mentioning that elderly patients with dementia-related psychosis treated with haloperidol are at an increased risk for death. Haldol is not approved for treatment of patients with dementia-related psychosis. Haldol is contraindicated with patients diagnosed with dementia-related psychosis. In case I did not mention it enough, I will say it one last time. Please do not administer Haldol in patients with dementia-related psychosis. Because one black box warning is not enough, we have another one. Neuroleptic malignant syndrome is a life-threatening side effect. Symptoms of neuroleptic malignant syndrome include a very high fever, irregular pulse, high pulse rate, rapid breathing, muscle rigidity, altered mental status, excessive sweating, seizures, and renal failure. A person experiencing NMS should be brought to the emergency department to be managed in the ICU. Drugs that may negatively interact with haloperidol include aspirin, Ativan, Benadryl, Cogentin, Lasix, Lexapro, morphine, risperidol, Tazodone, Xanax, Zoloft, and Zyprexa. When taking haloperidol, please avoid drinking alcohol. Notify your provider if experiencing uncontrolled muscle movements in your face, neck muscle spasms, Rapid changes in mood, pounding heartbeats, rigid muscles, trouble breathing, increase your fluid and fiber intake. Change your position slowly, stay out of direct sunlight, and for temporary relief of dry mouth, suck on hard candy.